My name is Asmita Ghimire, and I'm a healthcare data analyst at the Center for Improving Value in Healthcare, or CIVIC. Today, I will be presenting on transforming raw hospital pricing data into actionable insights, a project that supports better healthcare decision making through data transparency. All right, before diving into the data, let me briefly introduce Civic. We are a nonprofit, independent organization that provides data, resources, and services to support healthcare improvement across Colorado. Our vision is that everyone has access to affordable, equitable, and high quality care. What is in the Colorado All Payer Claims database? The COAPCD includes medical, pharmacy, and dental claims data covering over 70% of Colorado's insured population from 2013 to 2025. It contains over 1 billion claims from 33 commercial insurers, Medicaid, and Medicare. Our database is updated on a monthly basis. The exclusions are ERISA covered self insured plans, TRICARE, Indian Health Services, and the uninsured. Now, let's shift to hospital price transparency, the focus of this project. As many of you know, the US healthcare system is complex and fragmented. Care delivery and pricing involve multiple payers, including insurance companies, government programs, and the patient themselves. This complexity makes it difficult for individuals to understand the true cost of care. In fact, many patients don't know how much they will be charged until after they receive the bill. So, what is hospital price transparency and why it matters? In 2021, the Centers for Medicare and Medicaid Services implemented the hospital price transparency rule, requiring hospitals to publicly disclose prices for medical services they offer. This matters because it helps patients make informed decisions. It enables price comparison across hospitals. It promotes competition, potentially lowering cost. And finally, it increases accountability in pricing. Despite the policy, hospital pricing data is often difficult to navigate. Our hospital price transparency project aims to collect, clean, and standardize pricing files from 85 hospitals across Colorado. How we do this? We take machine-readable files from hospitals' website. We clean them and we load them into a centralized database to enable accurate cross-hospital comparison. This work is done in 4 key phases. Phase 1, initial file download and review. Phase 2, deep data cleaning and analysis. Phase 3, reporting database development. And the last phase is final or quality check phase. Let's dive into the phases now. In the first phase, we download the hospital files, we conduct the initial review, and we convert files formats as needed. And then we finally organize files in the central location for further analysis. Phase 2, this is the most intensive phase. We use many softwares like Excel, SAS, and R to clean and process the data. This involves identifying non-standard codes or formatting issues, restructuring rows when multiple procedure code appear on the same line, aligning modifiers and removing invalid or outlier values, pivoting from wider to longer format as needed, flagging missing or incomplete price information, splitting large JSON or CSV files for easier handling, and finally adding hospital level metadata and documenting the process along the way. By the end of this phase, all files are cleaned, standardized, and ready for reporting. Phase 3, the clean data is integrated into a centralized reporting database. We also add row numbers to help identify and reference specific entries. This database now supports cross-hospital comparison, pair-specific pricing analysis, and we can also query the data using CPT or MSTRG codes. And now the final and the last phase is quality check or QC. This is the critical step because we verify data accuracy, data completeness, and formatting consistency in this phase. The QC also ensures that everything is reliable and ready for use in reporting and analysis. What are the findings and key challenges that we came across? We encounter several challenges in working with hospital pricing data. Files are often large, so they are hard to load and process. Hospital interpret CMS rule differently, so file formats vary across hospitals. Many files have missing or blank values, and then some hospitals fail to meet CMS requirement or post unusable files. These issues limit the usability and impact of price transparency. Despite challenges, price transparency has positive implications for many stakeholders from patients to policymakers. Patients can compare prices and make informed decisions. Hospitals gain trust by being transparent. Employers get greater insights into negotiated rates, and policymakers can use the data to promote accountability and control healthcare costs. But of course, the full benefit depends on clean, usable, and accessible data. And lastly, some of our recommendations in conclusion. Standardizing formatting across all hospitals ensures data consistency, making it easier to compare prices statewide. Developing user friendly dashboards for easier access, and then encouraging third party tools that aggregate and simplify the data. This promotes innovations and helps transform raw data into actionable insights. That being said, hospital price transparency is a powerful step towards a more accountable, affordable healthcare system, but only if we make the data usable, comparable, and accessible to all stakeholders. Thank you so much for listening to me today. If you have any questions about the project or anything in general, feel free to reach out to me at the email address on the screen. Thank you. Bye bye.